Hello, my name is Luke Burrows. I'm a dental hygienist, an educator, and a member of the Dental Hygiene Community Impact Program at UC Blue Ash. Oral health is so important. You know, we often joke in the dental field that we just found out the mouth is connected to the rest of the body. Now, it may sound funny, but many people don't realize that when they have a cavity or an infection in their mouth, it can lead to tooth loss, serious pain, systemic infection. It can even be fatal. We have a dedicated team of hygienists, our faculty, our students, our volunteers, and dentists that come and volunteer with us to serve patients that don't have access to oral care. We all believe that everyone deserves to have good oral health. Now, I don't know if you realize this, but in Ohio, nearly half of adults have no dental coverage. We serve these patients in our clinic. We have a 34-chair clinic where we provide free and reduced cost care to our patients. The most they pay for treatment is $20. Also in Ohio, over half of the children in Ohio have no dental coverage. Over half of the children. And right here in Hamilton County, in the last 6 months, 1 in every 8 children has suffered from dental pain. We serve these children in a program called UC Smiles. They come to us from underserved schools in the area, and they receive free dental treatment, free dental cleanings, oral health instruction, so they learn how to take care of their own mouths. Now, access to care is obviously a serious issue, and we're doing a lot in our program to address this. But it's even more difficult for patients with disabilities and mobility issues. We had a young man come to us this past year with his mother. This young man had muscular dystrophy. He'd been confined to a wheelchair for many, many years. He couldn't take care of himself at all. He was totally dependent on his mother, and she didn't know how to take care of him. His mouth was an absolute mess, full of infection. Well, I'll tell you, in 3 visits, we transformed his mouth. He was able to smile again. He had a healthy mouth, and his mom now knew how to take care of him. But sadly, we didn't give him the best care possible, and he didn't have the privacy that you and I expect when we go to our dentist. He was out in the middle of the aisle in his wheelchair because we had no chair that we could transfer him to. Our goal, and with your help, we will install an ADA-approved chair that we can transfer anybody from their wheelchair into this chair. Our chairs right now are so small, so narrow, they don't swivel enough. But with this new chair, we'll be able to accommodate all the patients that come to us, to be fully inclusive, so this young man can come back to us, and all the patients with mobility issues and disabilities, we see so many of them, will feel free to come back to us and will receive the excellent care and the dignity that they so much deserve. Please join with us. Thank you.
Like your suit, Luke. Looking very handsome.
Oh, thank you. You look very nice yourself.
Thank you. For an old lady. Thank you. How much impact in the community will one chair provide? Just one chair?
That's an excellent question. We have 34 chairs, and none of them are suitable for the types of patients I described. We see many patients with all kinds of disabilities and mobility issues, maybe older adults, patients confined to their wheelchairs. And this chair, what we would like to do is to keep track of how many patients use this chair. I just found out that the ADA has not even approved the chairs that we have. They don't have enough room on either side, so we really need to get an ADA, American Dental Association, approved chair. We're going to use it as much as we can every time a patient comes in that needs it, and we are going to keep track of how many times we use it to track the benefit that it provides.